Hello, and welcome to Health is the Key, the podcast that explores the health and wellness issues that matter to 1199 SEIU healthcare workers. I'm your host, Elizabeth Moore. As you probably know, we try to tie our episodes to whatever Health Awareness Month is happening. Well, this month we're doubling down, turning our focus on both National Stress Awareness Month and IBS Awareness Month. What do stress and irritable bowel syndrome have to do with each other? More than you might think. Joining us to explore this body-mind connection is Dr. Preeti Mehta, a gastroenterologist and founder of the private practice Digestive Disease Care. Dr. Mehta will help us understand why 75% of IBS cases go undiagnosed, how stress affects the gut, and what's really going on in our body's so-called second brain. Welcome to Health is the Key, Dr. Mehta.
Thank you so much, and it's a pleasure to be here.
Thank you. So can we just get started with what exactly is irritable bowel syndrome?
So irritable bowel syndrome, or the short name of it, is IBS, as we all know about it. It's basically a very common disorder of gut-brain interaction. And it usually causes symptoms like abdominal pain, gas, bloat, diarrhea, constipation, or mix of both symptoms. But the most important thing to remember is that it doesn't really damage the intestines.
So it's not really like a disease. Can it progress to irritable bowel disease?
So usually there's a difference between IBS and inflammatory bowel disease. So with IBS, usually you have symptoms, but if you were to do an endoscopy or a colonoscopy, you really don't have any inflammation that we physically see, versus when you have a patient with inflammatory bowel disease like Crohn's disease or ulcerative colitis. In those patients, we find when we do a colonoscopy or an endoscopy, we find that there are ulcers, there are erosions, there's bleeding, etc. So in that regard, those are the two differences between IBS and inflammatory bowel disease, which is IBD.
Right. We've learned that it can affect nearly 45 million people in the United States, but it's often undiagnosed. Is that because it doesn't show up on tests as inflammation?
You're absolutely right. So about 1 in 10 person will really have IBS. And as you mentioned earlier, about 75% of the patients really would go undiagnosed. And majority of the patients are not even seeking out help because they're embarrassed to really talk about their bowel habits. And because of that, it goes just undiagnosed. And majority of them, they end up kind of isolating themselves, not going out, not traveling, not socializing. And so it's more of a stigma. Really, IBS is a real disease, and we need to make sure that patients are aware of it to seek help and not to be embarrassed.
I think that's part of the problem, that people don't approach, or they just think, well, this is just how my system works.
That's exactly right.
So they either don't seek help or they just live with it.
Most people normalize it unless that it's really starts affecting them in their workplace, in their daily living interaction with their family members, and etc. So that's when it comes to more noticing that, you need to really get help. And that's why it's important to seek out.
And so that brings in the mind connections. So it affects your relationships. It affects the way you interact with people. So, some people wonder, does IBS cause stress or does stress cause IBS? So how do those two work together?
It's a very good question, but it works both ways if you really think about it. If you were to look at the profile of a patient with IBS, a lot of them have stress, anxiety, depression, some trauma, or they're a little bit sensitive to food, etc. So those are the most common type of patients who end up having irritable bowel syndrome. Vice versa, patients who are already stressed, because they think about it so much, they end up having IBS. So it's basically a two-way street.
Right.
So you have to think about everything as stress can lead to IBS, but a patient with IBS who's always anxious and thinking about their stomach is also very stressed.
So I think it does get confusing that people think stress causes IBS, but stress can aggravate IBS, but it's not a direct cause.
That's exactly right. Absolutely.
Okay. And now we've heard so much about gut health. It's in the news all the time. So can you explain a little bit about gut health and how it relates to not just IBS, but just how the mind and the gut work together?
The newer generation is so in tune with their gut health. And I have every patient that comes in, and it's a very important question is, how do I get a better gut health? And gut health basically is how your digestive system works. How does the food get moved from your stomach to your small bowel into your large intestine? So it's the movement of food. Number two is also the microbacteria and the balance between the microbiota of the gut. That's another thing that plays a role in gut health. Inflammation is another avenue that also plays a big role in gut health. And the interaction between the gut and the brain is another thing which is also part of gut health. In patients with IBS, they have more issues with perceiving how they're digesting, how they're sensing, how the movement of food and what gas and bloat is. So in general, gut health is digestion, movement, and the interaction of how the gut perceives and how the brain perceives these symptoms.
I think a lot of people sort of think of the gut and the stomach as the same thing, but they're not. So can you just explain the different parts of the gut?
Absolutely. So the stomach is just your stomach, but the gut is actually involving the entire digestive system, which starts out with your esophagus, that leads into your stomach, then that leads into your small intestine, and then that connects to your large intestine. But along with that, you also have your liver, your gallbladder, and the pancreas, which also play a very important role because they produce all the enzymes that digest your food as well. So that really is incorporating the entire gut versus just the stomach.
Mm-hmm. And so problems can arise at any part of that system.
That's absolutely right. As a gastroenterologist, you have to be very in tune with what the patient is stating and where these symptoms are arising from. So that's why it's extremely important to take a good history. And it's also very important for the patients to be able to communicate with us so then we can actually follow through and work which organ is really affecting and causing these symptoms.
Mm-hmm. We've seen, too, that the gut is called the second brain. Can you explain that a little bit?
Absolutely. So the gut is lined with billions of nerves, and those nerves, they make a system called the enteric nervous system. And the enteric nervous system basically helps control digestion, sensation, and the movement of food and enzymes throughout the intestines. So that's why people call it the second brain.
Mm-hmm. And when you say it has all these nerve cells, and we've read almost as many as are in the brain, what is different about them in a person with IBS as opposed to a person without?
In patients with IBS, most of these patients have a little bit more of hypersensitivity. And that's why the enteric system is a little bit more sensitive to any kind of abnormalities in digestion or any kind of abnormalities in gas or bloat or constipation. And it's more of those sensations that are delivered to the brain.
And one of the things we'd asked you to explain, we've read that, and this was amazing to us, that in the gut produces 90% of serotonin, the feel-good chemicals, and 50% of dopamine, but they don't act the same way, the way the hormones are produced in the brain as the ones produced in the gut. Can you explain what they do then in the gut?
Absolutely. So the serotonin that's produced by the gut is more involved in helping regulate motility. It helps regulate secretion and sensation. It doesn't affect the mood, which the serotonin that's produced by the brain.
If a patient came to you to see you with, what kind of symptoms would they present with when they showed up and not knowing what was wrong with them? And because there is no definitive test or marker for IBS. How do you diagnose it?
Most of my IBS patients come and complain about that they're very bloated or they have severe gas and abdominal pain. And usually that is almost always associated with constipation or diarrhea, and sometimes mix of both. And so most common complaints are that they have these erratic bowel habits, that they don't know what can trigger it. And unfortunately, because the symptoms are so vague, we end up having to make sure that, there's nothing further. We're always looking for red flag signs, right? Because patients with IBS, since their symptoms are such a variety of them, we have to make sure that there's no weight loss, that there's no anemia, there's no family history of Crohn's or ulcerative colitis. So you have to be very careful because these patients can almost have similar symptoms that are of a patient with celiac disease or similar symptoms of Crohn's disease. So you have to be very careful in terms of how the patient is presenting. And that's where when an IBS patient comes in, we always make sure that we check their blood work to make sure there's no anemia. We make sure that, sometimes we also talk about, if there's other red flag signs like weight loss, if there's any blood loss, if there's any drastic change in bowel habits, because in patients with colon cancer, they also have alternating diarrhea and bloat. So these patients have very variety of symptoms, but we have to kind of pay attention to anything that may trigger us to do further workup. In patients with IBS, most of them would have normal labs. They would have normal scans. And unfortunately, many of the IBS patients, when they go see a gastroenterologist, they end up getting a colonoscopy, endoscopies, CAT scans, blood work. And unfortunately, at the end of the process, they still don't have an answer. And usually the patients that I see in my practice, I usually see a third or a fourth opinion when they're exhausted because they've had so many procedures, so many tests done, but nobody's able to really give them an answer. And they're told that everything is in their brain. So that's when you have to kind of be very careful, and you have to have a sit down with them and really go through that. Listen, let's really talk about this. And it's a diagnosis where you have to take a detailed history, go through their lifestyle, like what are they doing in their lifestyle, what stressors do they have, what's affecting them, how's their work-life balance, because all those really affect their gut. And as we talked about, it's a gut and a brain interaction disorder.
And that just adds to the stress. Trying to find out what's wrong and not getting answers can just exacerbate everything.
That's exactly right. And that you made a very good point. Is it stress? Is it the IBS causing the stress, or the stress causing the IBS?
So when someone is diagnosed with IBS, if they've gotten a definitive diagnosis, is there a cure, or is it just modifying the way you approach diet and lifestyle that will help improve it?
Right. Some of the common triggers that have been, shown with IBS is fatty foods, carbohydrates or fermentable carbohydrates, patients with smoking and alcohol history, or a low-fiber diet. So usually when we say is IBS curable, it's more about how well you work with your physician. Because we can't cure it, but we can modify it. We always have an interaction with the patients. Let's see if we can change some things. Let's add more fiber to your diet. Let's have more fruits and vegetables, which are antioxidants and which have a lot of already in the probiotics that you don't need to take, but they are in the fruits and the vegetables that you're eating. We try to coach the patients about, to modify the amount of carbohydrates the patient is getting. Exercise is extremely important in patients with IBS. And it's a conversation to have all the time because, as we talked about, stress and anxiety are part of IBS. When you exercise, you have the good hormones that are released, endorphins. We also talk about good habits, good sleeping habits, good eating habits. Nowadays, America is really going towards the processed foods. Grab a bar and go to work and come back and not have anything for lunch and come back, have a big dinner and call it a night. And I think that also feeds lot into the patient's IBS symptoms. I sit down with my 18-year-olds, my 25-year-olds all the time, and we really say they're working, they have a job, they're studying, they're trying to make a career. And then they're like, Dr. Mehta, I don't even care about what am I eating. I just want to eat because I have so much work to do. Or when you have the typical 35 or the 45-year-old who's working, coming home at 5, 6 o'clock, doesn't think about themselves. They go home and they take care of the kids. And then it's 1 o'clock, and that's when they're like, okay, let me grab something. 30% of my patients with IBS have stress. I always talk to them about how we can decrease it. What can we do to help you? I keep a very close follow-up with them. I bring them every month, even if it's like a 15-minute conversation. But when I notice that the stress and the anxiety and depression are really playing a big role, we have a psychiatrist. We have an online program with a psychiatrist, and they go see the psychiatrist and therapist because it's really important. And we've seen such a difference because they're able to kind of unload what they're feeling, and you see a difference in patients' symptoms. As much as we can talk about nutrition, our nutritionist colleagues are much more aware. And so we have them see a nutritionist as well. But my pet peeve is to always stay in moderation. We don't like to go to extreme diets. I'm sure my IBS patients have been put on something called a FODMAP diet.
I wanted to ask you about that because I've read a lot about that.
That's right. So, with FODMAP, it's basically don't eat anything. And
that's tough.
It's a very tough diet to follow because you can't eat carbs, you can't eat beans, you can't eat broccoli, you can't eat cabbage.
All the things that are good for you
all
nutritionally.
That's exactly right. And the patients come back to me, Dr. Mehta, my nutritionist said to me that I can't have any of the gas-producing vegetables, but they're the ones that are important for fiber. So it's important to also have a good nutritionist that you can interact with, where you have to kind of modify one at a time, not where the patients are told to avoid everything. Because in IBS, the more you avoid, the more sensitive your stomach becomes. What you're doing to your stomach is training them, especially when you say it's a gut and a brain interaction disorder. So IBS patients are training themselves accordingly. So it's important to train and have good habits that will train my nerves in my gut, which will communicate to my brain.
Can you talk a little bit about the FODMAP side? Because I'm not sure that many of our members know about it, and it does sound a little bit confusing. So if you go to your doctor and they recommend this, what can you expect?
When we talk about a FODMAP diet, it's a very strict diet, and it really involves you to really not consume carbohydrates, which are unfortunately very easily fermented and which indirectly can cause a lot of gas and bloat. That also includes all kind of green vegetables, which it's a little bit difficult to digest, and that can also produce a lot of gas and bloat. We also talk about fruits. Some of the fruits are also high in sugar. But what you can't have fruits, can't have vegetables, can't have carbs. Those are the good things in life. So research has shown that FODMAP diet works, but then again, it's not practical.
Right. It's not sustainable.
It's not sustainable. It's not long term, and that's when patients get frustrated. And then they go on it for a month. It makes them feel better because it's right, because you're avoiding all the carbs, you're avoiding all the fermented fruits and sugars, and you're not eating any of the gas-producing foods. And if you start avoiding all this, you're going to feel good because you're not eating any of that stuff.
So the nutritionist in your practice would approach an IBS patient how?
We, in our practice, are very careful in terms of being moderate. So the nutritionist knows that, as we just talked about, everything in moderation is key to success. And we really discuss with our nutritionists that we don't want to have the avoidance therapy. I tell my patients and the nutritionists that they're going to bring a homework diary. So I tell my patients to, for a month, write down everything that they're going to eat. And along with that, they write what their symptoms are. And along with that, they write how their bowel habits were. And along with that, they write how their emotion was. Good, stressed, I had a fight with my boss, I want it written down. Because truly, as you said, most of my IBS patients, they come in after they had all the procedures in the world, and I'm now there they're looking at me, Dr. Mehta, what's wrong with me? So with me, I take that diary and they sit with my nutritionist. And we look together as a patient as a whole to see, wait a minute, this was a weekend and you were able to eat everything and you were fine. And your symptoms were totally normal. So truly, is it really what food was triggering it? No, it was stress.
Right.
Then we look at other days, but we see, wait a minute, it seems like you're consuming a lot more carbs throughout the day. And my nutritionist would sit with them and say, let's try to cut down a little bit, not eliminate, because elimination is a completely different diet. So it's always work in process to look and review what the patient has gone through that days and that month and pick out and highlight what's really triggering them. And then that's how my nutritionist and myself work together to treat an IBS patient, because it's not easy. It's probably the most complicated disease. On the other hand, IBS patients are misdiagnosed. A lot of them, after listening to them and we end up doing some basic generic workup, we'll see, wait a minute, her B12 levels are a little bit low, or the patient has iron deficiency. The patient has a family history of autoimmune disease. The patient has a brother with a history of celiac and Crohn's. You have to start being a little bit more thinking and wait. In fact, my nutritionist and our team will work with that patient and say, you may be that patient who I need to do a little bit more digging deep and not just put you on this diet and not just say you're stressed out and let's go see a psychiatrist or a therapist. So it's a team approach to IBS.
So it does seem like there are multiple approaches to treating someone once they've been diagnosed. So like diet, mind-body practices, exercise, and stress management for sure, and quality sleep, which I think a lot of people overlook.
Absolutely.
One of the things I wanted to ask you about gut health in general, you hear so much about people taking probiotics just to get healthy gut. Do they work?
Prebiotics, probiotics, there are so many different kinds. I mean, if you go to any of the stores, there's such a variety. Most patients come like, Dr. Mehta, should I buy the ones that are less expensive or the ones that I bought this from Amazon and I bought this one from refrigeration and it's cost me $150. They're helpful, but if you really think about it, go back to what prebiotics and probiotics are. They're all natural bacteria and microbiota that come from eating healthy. So I talk to my patients about fruits, vegetables, and grains. Those are the three things that will give you your prebiotic, your probiotic. And my IBS patients, they come on with 10 different medications. And unfortunately, they're spending a lot of money on it, but you just have to kind of sit with them if you look at them and say, listen, let's really work on your high fiber diet. Let's try to get more fiber by eating different type of grains and etc. So I'm a fan of prebiotics, probiotics, but my first line treatment is not that. I like my patients to naturally get them. And again, the idea is, am I going to be on this pill for the rest of my life? Why can't I just not do things naturally? I can save money, and they're helpful, but let's work on diet first. Let's get things that are good for you, which already are natural. And if it doesn't work, we have them. We'll work with that too.
And if you don't really need them, can they do harm to you? And you're taking them?
They really don't do harm because they're natural. These are natural probiotics with natural bacteria, which are part of our gut. But sometimes excessive of these prebiotics, probiotics can cause an imbalance in what already exists. So that's why you have to be a little bit mindful of how much, what kind you're taking. So it's always good to have a discussion with your physician that which one do I need to take? Am I disrupting the gut flora? But technically, they don't really cause any major harm because they're part of you.
So a good rule of thumb is always talk to your doctor first.
Absolutely.
Well, we've learned so much about gut health and stress and IBS, and we want to thank you for coming in. We'd like also to ask if there's anything you'd like to leave our members with.
I would say that don't shy away from reaching out. IBS is a real disease. It has a lot of stigma associated with it, but don't be afraid. reach out. And I would say that when you go see a gastroenterologist, make sure you demand the time that you deserve so that they can sit with you, talk about all the different options that exist, and make sure that IBS is not missed and there's nothing underlying that's serious. And if there are red flag signs, and be aware, listen, if I'm losing weight, I'm anemic, I have a family history of significant GI disorders, bring that up so that your gastroenterologist doesn't miss it and spends time with it. And it's a team approach. Make sure your nutritionist is involved. Make sure there's a psychiatrist that's involved. It's a team approach. It's working together and figuring it out how we can take care of you.
That's great information. Thank you so much for joining us.
Thank you so much.
Tune in later this month to our April keynote to hear Dr. Mehta share more information about celiac and Crohn's disease, conditions that can often be confused with IBS. For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.